Now, people who are fully vaccinated might have a right to a greater expectation of freedom, even if others refuse or defer getting inoculated. That's the view of Professor Peter Collignon, an infectious disease physician. 6.5 million doses of the vaccine have been administered in Australia, only about 3% of Australians fully vaccinated. Professor Collignon has argued that once 70% of adults are vaccinated, we need to gradually open our borders and adopt a different attitude to what risks we are willing to accept. And Peter Collignon joins us now. Good to see you. It's been a while between conversations. Professor, thank you for your time. Is there any sign that the government is willing to have this conversation with the Australian people yet?
Well, I don't think it's started yet because we've got to wait before we get that number of people vaccinated. But the reality is that once you're vaccinated, your risk to yourself is, considerably lower, 95% lower, both mainly from dying and getting infections or serious infections, but also you decrease your risk that if you get it, you'll transmit it to others. So we do this for lots of other diseases where we have vaccines for. I don't think we should make vaccinations compulsory. But by the same token, people who decide not to get vaccinated or delay it, they may have to deal with, some of the consequences of that. And one like measles, for instance, if you're not inoculated for measles, if there's a measles outbreak, your children can't go to school, and various other examples like that. And I think this will be similar. Once you're vaccinated, if you're overseas, I would think home quarantine will be an option for you. But compared to somebody unvaccinated coming from high prevalence countries, they still probably will have to go into some sort of 14-day supervised quarantine. So I think as time goes on, as we get more people vaccinated, the rules will change, as they should. And basically, we don't actually know how many people we have to vaccinate, but I would think we're talking about 70 to 80% of the adult population. And I would hope that for people over the age of 90, where 90% of the deaths occur in serious disease, that we get 90% plus vaccination, because that means even if there is spread, the consequences, both for other individuals and ourselves, are so much less than if we're not vaccinated.
Yeah, Professor, we're not seeing any signs of that happening now. We've only got about 3% of the entire population fully vaccinated. 20% have had one jab. So we're quite a way away from that. But without giving any freedom, I mean, if you get vaccinated now, you're not giving it any more freedom. You're still at the risk of being shut out of other states. You're still at the risk of going into forced quarantine. Is that all feeding into a bit of hesitancy, do you think?
Well, I think it is. I think we need to do more. I'm more optimistic about these vaccination numbers than you are. First of all, over 2/3 of those over the age of 70 have been vaccinated. Now, I'm disappointed that it's not 80 or 90%, but we should be able to get there. So, and they're the group that we're up the front of the queue, quite rightly. So I think one of the reasons we don't have enough people vaccinated, there's still a shortage of supply. The only vaccine we'll have in large quantities or sufficient quantities for the next couple of months is the AstraZeneca. Now, that's available to everybody over the age of 60, and they're the people who contribute to 95% of deaths and serious disease. So get vaccinated. The Pfizer vaccine, it's arriving, I think, at about 250,000 doses a week. But that actually means it'll be a while before we get, millions and millions of people vaccinated. But by the same token, the fact that there's 20, I think even 27% of people in Australia who've had the first dose of vaccine shows that people are willing to get out there and get vaccinated. What we want to do is make sure it doesn't level off when we get to 60% or something similar that's happened in some other countries with more supply of vaccine. But basically, we're still in a very good position in Australia. We are better than everywhere else in the world as far as I can see. Even Taiwan, that had better control than us, was having hundreds of new cases recently. So we've kept good control. Even with the Melbourne outbreak last year, we've got control. Yep. So we have time up our sleeve to roll this up. So I don't think this is the end of the world. There is a supply problem, but you can argue, should we have our 30-year-olds vaccinated before people in Europe, or for that matter, Brazil and India, who are 60 and 70, should we take vaccine before them? There is a global shortage of vaccine. That will improve over the next few months. We will get a lot more vaccine in 2 or 3 months' time, but it still means by the end of the year, and probably earlier than October, all adults who want to be vaccinated will at least have received a first dose. And if the dosage intervals are shortened, by the end of the year, most adults will have received 2 doses.
Indeed. And look, we still hear from government and people like General Fruin that timeline is on track, but there is going to be a rush at the end of the year when we do get more of these vaccines. We're promised 2 million Pfizer will start to arrive by October. The question is here that we see decisions still being made by chief health medical officers right around the country. One heartbreaking story is Mark Killen, who is vaccinated. He's come from the US. He was given an exemption and then stepping in at the last minute. I mean, he's offered to wear a hazmat suit and the risk is really low and he wants to see his dying father. Can you understand why these decisions are being made, or is it a bit of overkill sometimes?
Well, I think a bit of them are too harsh and a bit overkill. I think we need to have a bit more leniency. I mean, after all, before we had vaccines, we were allowing return visitors to see their dying parents. A year ago, I know that was happening. And I would think if somebody's vaccinated and you're taking reasonable precautions with, mask, eyewear, etc., and for the staff, you should be able to do this safely. And if occasionally there is an infection, we should be able to handle that. I mean, if you look at the track record of Australia, when we've had outbreaks, clusters, it's been brought under control within usually 2 to 3 weeks. So I think we need to be a little bit more lenient with these unusual conditions that are heartbreaking, and particularly when people have been vaccinated.